morning. I'm Dr. Dhruv, and we're going to talk a little bit about how to read labels. And I know when I first came into town, I used to actually take patients through Publix, the grocery store that we have here, just to learn how to read labels. Remember, a lot of wanting to sell you thing is all about marketing. Marketing trying to get you to buy different types of equipment, clothes, and food is no different. And so it's really important to try to look at the food label and not get swayed by the nice packaging. And how it affects not only, we talked a little bit about diabetes, thyroid disease, cholesterol, bone health, but how all those sort of things come into play all together in all the organs in our body. When we're thinking about looking at food labels, look at serving size. When we look at just the number of calories, we're thinking, okay, well, that's not bad when we realize the serving size is probably 2 little bites. So that's extremely important too, because we don't really look at that. Also look at total carbohydrate content. The other big misconception that there is that there's net carbs. Net carbs because there's good carbs, complex carbs, simple carbs, and then the net carbs in somewhat situation can actually be better. That may not necessarily be the case. Carbs are carbs. Yes, there are certain carbs that are better, but all carbs do increase your body's production of insulin. And with that increase in insulin causes, if you're not utilizing it, to be deposited as fat. And so it is important to take a look at what they're talking about as far as serving size. Also take a look at what they're talking about as far as carbohydrate intake. Also, if you can't read what a label says, what the ingredients are, that may not be all that great for you. Interestingly enough, I always tell my patients, try to shop in the periphery. Try not to go into the lanes. The lanes are more the processed food. The processed food, unfortunately, has a lot more preservatives in it. With those preservatives, because you want to keep the half-life longer on the shelf, that becomes a problem as far as the effects it may have long-term. We're just now beginning to understand it, what that may be. Are there carcinogenics in it? Are there so small amount of it that it doesn't really matter? But if we eat a lot of it over time, will it matter? So I think all of those do come into play. The other thing I would say is if you can try to make something fresh, make it fresh. It takes a little bit more effort. I know on Sunday night I will cook for the next 2 days, because when I'm hungry and I come home, it's so easy just to get something convenient as you're driving home from a fast food restaurant. Or, and then just have it nicely, all you do is warm it up. And then, maybe what I do is probably cook on Monday and then cook again on Wednesday. And then the weekend is there for me to cook anyway. So just a little bit of planning makes a huge difference. The other thing is when we talk about trying to make things fresh, that goes for what we think may be fresh as well. Egg beaters. Egg beaters, I naively thought, were just whites of eggs with some yellow food coloring. To keep that shelf life longer, there's got other stuff in it to keep it longer. Can you imagine just having a whole bunch of white eggs in a carton and thinking it would last that long? From the time it's manufactured, shipped over, and put on the shelves in the grocery store till by the time you can use it, not once but many times. Same sort of principle. Even if you take oranges and squeeze it to make orange juice, the not from concentrated that you get from the store still has other things to keep the half-life longer, the shelf life longer. And we know that from in Miami. I remember we used to always have freshly squeezed orange juice. It was there that they made it. They had a big press, but we had to drink that orange juice very quickly because it was sour. Whereas the orange juice that we get, from the store does last a little bit longer. The other thing that I would actually advocate also is not also looking at what the packaging looks like. You can have anything say anything. It could be lean something. There's no problems with calling it anything. It doesn't mean that just because it's lean, it's relative to what. When we looked at labels, some of the lean cuisine labels versus just regular food that you can get from the deep freezer, the TV dinners, lean cuisine was actually worse in the sense that it had higher fat content, higher carbohydrate content than just the regular meal that wasn't packaged as pretty. So don't get swayed by packaging. The other thing I actually advocate a lot about is over the counter. A lot of patients think that just because it's not prescription, that it may not be bad. that it's natural. Remember, tamoxifen, which is chemotherapy for breast cancer, comes from a bark of a tree. Just because it's natural does not mean that it does not have side effects associated with it. So, for instance, you get from the health food store, DHEA, DHEAS, those are precursors to testosterone. For a while, that was actually taken off the food market, the GNCs and so forth, because people were coming in, women were coming in with hair growth, hirsutism, hoarseness of their voice, depending on how much they took. Just like that there's an FDA, Food Drug Administration, for prescription drugs, there's now an NDA, which is for those agents that we can get over the counter. So just because something is over the counter does not mean that it doesn't have side effects associated with it. Ginseng, if you go under anesthesia, tougher time waking up. Ginkgo biloba, if you get a cut, much more difficult time healing. We realized those in smaller studies because it was used so much. Chromium piconate, just because, like I said, it's the biggest and fattest thing, doesn't necessarily mean good old-fashioned getting it from the making it yourself. Another prime example is turmeric. Now there are good studies on both turmeric as well as ginger. Ginger does decrease dyspnea on exertion, difficulty breathing when you're exerting. P&D, some people can, when they're sleeping, can't sleep lying flat. They have to kind of have the bed tilted a little bit. That's P&D, that's proximal nocturnal dyspnea, difficulty breathing when sleeping nocturnally. So ginger does help with that. Now there's ginger capsules. If you just go to the grocery store and get some ginger root and try to put that in food, it adds a lot more benefit than just getting it from what nature intended. Is a lot easier to take than what man has made in a capsule form. Same sort of principle goes with turmeric. Turmeric root you can also get from the grocery store. There's also turmeric powder that you can get from the Indian grocery store as well, but turmeric root probably is even better than the turmeric powder. Again, if you just grate it a little bit and can put it in food, that's actually a lot better for you than getting it in pill form. Calcium. Calcium is difficult, right? Because the amount of calcium that you need for women and for men is about 1,200 milligrams of calcium a day. If you get that from diet, that's about 4 cups of milk a day. If you get it, if you're postmenopausal women, you need 1,500 milligrams of calcium. So that's about 5 cups of milk a day. So that's a little bit difficult to take. Some of the calcium tablets, they're kind of big, and they do cause constipation. What I actually advocate for patients is it's over the counter, it's called Viactive. Viactive are these calcium chews. They're chocolate, there's caramel. When I got them, I ate the entire box. So my point is, it's tasty, it's a lot, constipation is not of an issue. So those are some of the other options if you really can't get milk, by drinking it. The other is vitamin D. Now, 30 minutes out in the sun would be great to get vitamin D. I live in Florida. You would think going from the car to the grocery store, get enough vitamin D. We have quite a bit of vitamin D deficiency. So usually if you're, and also California, Texas, and Florida is the highest skin cancer risk. So you don't necessarily want to be out there. I know I do have patients who are 16 years old, surfing, darker than I am, can be vitamin D deficient. Vitamin D does not equate with dairy products. Dairy products have to be vitamin D fortified. So in other words, I've got patients who say, oh, I eat a lot of yogurt, I have a lot of cheese, I should be getting my vitamin D. Not so much. Regular milk, not just regular whole milk, but just normal run-of-the-mill milk has vitamin D fortified in it. They're also now making almond milk that's fortified, soy milk that's fortified in vitamin D, but it has to be fortified. So look at your label and see if it has vitamin D, because just because it has calcium does not necessarily mean it has vitamin D. The amount of vitamin D you need is about 1,000 milligrams. That's about 30 minutes of being out in the sun a day. Obviously, if you live in the northern part where sun exposure may be less, then obviously you have to quantify it. Sun exposure also helps with depression. Interestingly enough, in Alaska, there's highest incidence of depression during those months where it's very dark. And so a lot of people, or a lot of physicians, advocate getting UV light. because that'll actually help with depression more than even just taking a pill. Obviously, there are worsening forms of depression where oral medication is needed. And I am obviously a physician. I don't advocate not taking medicine. I'm just advocating other avenues that we may go. And obviously, mood can be situational, stress can be situational. So obviously, trying to resolve those things is also always prudent, especially women. You know, men yell and scream and get it out of their system. We seem to internalize. So a lot of times, our trapezius muscles will be really tight. We can internalize having stomach pains, ulcers. So it's extremely important to step back and reflect. You know, the whole sweating, not sweating the small stuff is a good one. It is important to really see, is that really important? Do we need to do something else? So those are sort of broad recommendations about reading labels and the importance of taking a look at them and how to prepare so that we don't find ourselves eating out and eating poorly even when we do eat out. Now remember, eating out, I did mention in another excerpt, eating out is difficult because of the mass production of food. We looked at salad, raw vegetables, took it from salad from a grocery store. Blood sugars were actually 20 points higher from no croutons, no dressing from a restaurant than it was at the grocery store. Why is that? Are they getting mass production of vegetables from a different source? It's unclear. But we are now looking at different avenues. Also take a look at whole wheat bread. You know, you think whole wheat bread could be more complex rather than white bread. Some companies, there are 2 companies, where the white bread is actually more nutritional than the whole wheat bread. So do take a look at the labels, and just having that power and that empowerment makes us all have better choices. Well, thank you very much. I appreciate it.